and we've got to drive out access to this extraordinary resource, because I think the day is coming when video communications is an indicator of the health of a community.
Despite many disadvantages the coronavirus pandemic has created in America, medical professionals at the University of Virginia see this moment in time as a breakthrough in telemedicine.
COVID-19 was a very, very powerful lesson in how important this tool is.
Telemedicine companies and healthcare professionals have partnered to allow isolated virus patients to connect virtually to chat about their symptoms with caregivers. A team of researchers at UVA's Karen S. Rheuban Center for Telehealth established themselves as pioneers in telemedicine after developing tools in response to the Ebola virus outbreak back in 2014. Director of Telehealth Operations at the University of Virginia, David Catell-Gordon, believes COVID-19 has accelerated and permanently transformed the use of telehealth tools.
You're able to isolate the patient securely and protect the frontline staff completely, and yet still have meaningful clinical and supportive conversations. It is going to require hospitals everywhere to be able to have video conferencing systems at a robust enough level to be able to see patients.
Do you anticipate the use of telehealth tools going beyond the virus into primary care going forward?
We'll never go back to zero. We'll never go back to zero. We'll go back to a lot of inpatient care that is physical face-to-face care, but there will always now be the option of doing this. It's not that it's going to totally replace face-to-face, but we're all equipped with our smartphones and smart devices to be able to do this. So a lot of our healthcare will get managed this way.
Has telemedicine proven effective in reaching those homeless and more vulnerable uninsured populations?
We've had some fits and starts of telemedicine to the homeless in our Charlottesville, Albemarle community. And then we realized if we're talking virtual connections to vulnerable and isolated populations as their VIPs, these are the most important people in our community, are the people who have so little. They should be our VIPs. They should be the very important people that we reach with this. You know, we can't live in this two-nation environment anymore with those that have and those that have not. We have to have specific broadband plans for communities that do not have the resources. We no longer can pretend after COVID-19 that it's okay to have people without health care. We are going to have to overcome the digital divide, and we have the means to do it. We just need to have the political will to stand up and say, yes, people need to have access. If we're gonna deal with this every few years to have a pandemic, we've got to have this in place and change the way we deliver care.